So I would like to share a story about a physician that I had a conversation with at Children's Hospital of Michigan. And I really think that this story illustrates the importance of us educating healthcare practitioners about stress and trauma and how it manifests in kids. Because without that awareness, many times the treatment and intervention strategies that they use can be quite different than what the child might really need. So as you know, I do some lecturing at Children's Hospital of Michigan on Thursdays, and I always have an opportunity to go into the clinic after I'm done. And I was heading down and I was heading to kind of check in with the social workers down there who we have contact with on a regular basis. And one of the physicians was walking towards me and he looked like really, really stressed out. And I said, are you okay? And he said, yeah, I'm looking for social work. And I said, social work's right here. And actually he's one of the residents, so he wasn't super familiar with the layout. And he said, that's where I'm headed. I don't know what to do. I have a mom and 3 kids in this exam room over here, and one kid is jumping up and up onto the exam table and then off the exam table. The other kid, it looks like he has markers and he's drawing on the wall. And then he said, but that's not the only problem. He said, the problem is that this mom hasn't brought her kids into the clinic for a well visit in a few years. They were all school age kids. And I just took their blood pressures and I don't know if I should send them to the emergency department. He said their blood pressures are sky high. They're 160, 170 over 130. And he said, do I send them to the emergency department or can we do a full metabolic workup? I just don't know what to do. And I said to him, what's been going on with them? What's been going on with the mom? And he looked at me and he said, they've been living in their car. And they haven't had food. And the only reason mom brought kids in today was because she knew that they would get a snack. They had been eating toothpaste. They had toothpaste that they got from somewhere, and they had been eating toothpaste out of the tube in the car. So what we did was, of course, go in there with not just the 2 social workers and a psychology intern and myself and the physician, but we were able to go in there and say, oh my gosh, what is happening? Let's give you some, obviously, a snack for all and some real wraparound support to begin to identify what we can do to help get you some food and some access to housing and clothing and some care. So what we know about trauma and stress and what the literature shows us is that hypertension and cardiovascular disease is very, very much a risk factor for people who have had exposure to stress and trauma. And that has been shown in the Adverse Childhood Experiences study. That's the first study that has really connected the impact of childhood trauma to not just later mental health outcomes, but later physical health outcomes too. And the physician said, I didn't even think about that. He said, I just felt like, oh my gosh, I don't know if there's a genetic component or what's going on. And he said, I didn't even think about the stress response. And what we always talk about in our trainings almost immediately, probably within the first hour or 2, is the impact of trauma and stress on our central nervous system. And what the literature shows us is that when our HPA axis is activated, or our kind of our stress response is activated, we're able to engage and we're able to endure stress for a short amount of time. But when that central nervous system is clicked on and it stays on for a length of time because what we're experiencing is so terrorizing, or it goes on for so long, is that we have intense dysregulation in our nervous system. So if you think about what happens when you almost ran a car in front of you, you know that your heart races, right? Your respiration increases, your blood pressure increases. All of those central nervous system functions really kick into high gear because it becomes on alert. It's trying to make sure that you can survive. And that is exactly what was happening with these two kids and this mom. They were all in such an activated state of arousal that they looked just like hyperactivity, defiance, moving around like you wouldn't even believe in a tiny room. And their indicators or their vital signs represented the fact that that stress response had been kicked on and had been on for quite some time. So just a quick story to let you know just the importance of our work in helping to educate another set of practitioners. For so long we've worked with mental health practitioners and with educators, and now we're having a unique opportunity to work in healthcare. And what we're finding is that many of the medical students and the residents that rotate through the clinic at Children's Hospital of Michigan have never learned one thing about trauma's impact on the body. So what they see is they see a metabolic issue or a high blood pressure, hypertension, or obesity, or different symptoms and reactions that might look like something like ADHD or oppositional defiant disorder. And now what we're able to do is have them kind of think beneath that and say to themselves, gosh, I wonder what has happened that's driving the symptomology that we're seeing in the exam room.